Dementia risk tied to these commonly prescribed drugs in a new study. A study published in the journal on Monday suggests that the link is strongest for certain classes of anticholinergic drugs, particularly antidepressants, bladder antimuscarinics, antipsychotics, and antiepileptic drugs. Researchers wrote in the study that She said that people taking these medications are advised not to stop them without consulting with their doctor first, as that could be harmful. The study involved analyzing data on 284,343 adults in the United Kingdom, aged 55 and older, between 2004 and 2016. The data came from the researchers identified each adult's anticholinergic exposure based on details of their prescriptions. The researchers also took a close look at who was diagnosed with dementia and found that 58,769 of the patients had a dementia diagnosis. The researchers found no significant increases in dementia risk associated with antihistamines, skeletal muscle relaxants, gastrointestinal antispasmodics, antiarrhythmics, or antimuscarinic bronchodilators, according to the data, but associations were found among other classes of anticholinergic drugs. The researchers found that the odds of dementia increased from 1.06 among those with the lowest anticholinergic exposure to 1.49 among those with the highest exposure, compared with having no prescriptions for anticholinergic drugs. The study had some limitations, including that some patients may not have taken their prescribed medication as directed, so anticholinergic exposure levels could have been misclassified. The researchers found, however, since the study shows only an association, more research is needed to clarify. Additionally, it has been well known that anticholinergic agents and confusion or memory issues are linked, but the new study investigated this association over a long period of time, said Dr. Douglas Shar, director of the Division of Cognitive Neurology at the IN Columbus, who was not involved in the study. He encouraged any patients who might have questions about this association to talk to their physicians.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.